It is important to understand that the UK court has not banned the treatment of transgender youth. They simply have inserted themselves in the process, and the implementation of the decisions is stayed until at least the 22nd of December 2020. In my view, one of the dangers in the judgment is, in fact, the judge's use of the term that they consider puberty blockers experimental drugs. This is lazy language and is generally used by many for positioning purposes. According to a recent academic paper, a 1. Puberty blocker has been used with gender dysphoric youth since the 1990s, near 30 years, so their use is hardly experimental anymore. Drugs can be, and are often, used off-label for a variety of reasons, and their administration remains ethical. In the field of pediatrics, off-label use of drugs is not uncommon due to the cost of having the medication labeled, when the clinical studies have been primarily involving adults. While some countries are encouraging pharmaceutical companies to expand their pediatric clinical trials, these funding pathways do not usually cover already approved medicines. What many of the anti-transgender treatment commentators call for is a traditional clinical study on the use of puberty blockers, meaning randomized control studies. However, such studies would be unethical, and a double-blind study would not be possible. A gender dysphoric youth seeking treatment and seeking pubescent delay in such a study, half would receive placebos, and their transition into puberty would continue, be visible to themselves and the clinical researchers. Ethically, there is a significant question as to the appropriateness of a trial that permits a transgender participant to go through puberty and subsequently have to have additional avoidable surgical intervention, increasing numerous risk factors for those participants.